talk about this connection. Weight, fertility, what are we seeing in these studies, and kind of how revolutionary is it to learn something like this?
Well, it's so important to talk about this because over 40% of men and women in this country suffer with obesity. And not only can it impact your general health, we know that it can have a profound effect on your fertility. The main mechanism is in women, it tends to disrupt ovulation. And this is because a lot of times when people have obesity and excess weight on their bodies, they are insulin resistant. This can cause your ovaries to produce too much testosterone, and it interferes with the signals from the brain to the ovary, leading to irregular or absent ovulation. And I always say when it comes to trying to get pregnant, if you're not ovulating, you're not in the game. On the male side of things, it can actually lead to excess estrogen production because in the fat cells, that's where you have testosterone getting converted to estrogen. So it can lead to sexual dysfunction as well as problems with sperm quality in men.
I think that's a surprising thing to some people. When the obesity with men, weight is a factor, right?
It affects both men and women, exactly.
Wow. And for men, how often are you hearing that they're surprised to hear that something like their weight could impact their sperm quality?
I think a lot of the responsibility tends to fall on women when we think about optimizing health and trying to optimize your fertility. But, you know, most people will be shocked to find out that their chronic medical conditions, including obesity, can impact their fertility, whether they're a man or a woman.
We had a lot of important conversations about the male infertility piece of this, which is a huge issue even for women. So how can these weight loss drugs that we talk so much about, Ozempic, Wegovy, help? I mean, is it, if it's going to help the obesity, does that help fertility, or can they have an impact on fertility?
So weight loss drugs are one piece of the puzzle. Obviously, we always recommend diet, exercise, healthy lifestyle, but sometimes that's not enough, especially when you're dealing with your biological clock and the fact that fertility is time sensitive. It can be helpful to accelerate weight loss with the help of medical interventions. So you mentioned the drugs like Wegovy, Ozempic, for example. These actually work on your brain to suppress your hunger and make you feel as if you're full, even if you're not. And so by reducing the number of calories you're taking in, it can help you reduce the amount of weight on your body. It can help reverse insulin resistance and a lot of these hormonal imbalances that lead to infertility.
So for anyone who is trying to get healthy enough to conceive, what's your best advice for them?
Definitely work on having a healthy diet, trying to control your portion size, exercising at least 3 to 4 times a week. Talk to your doctor about whether there is a role for certain medical interventions, whether that's medication or even things like bariatric surgery. But it's also important to point out that we don't have enough safety data on taking these weight loss drugs while pregnant. So we do recommend stopping them 2 months prior to conception. For patients who are undergoing fertility treatments, usually if they're going through an egg retrieval cycle, we allow them to continue them up until they start their shots for that procedure.
For people who maybe have been having a tough time trying to conceive, at what point is this something that they should think about? Because I know all too well, especially from you being my own doctor, the myriad of issues that you could have that could be preventing you from getting pregnant. When do you think about this one?
I think you think about it from the beginning, right? Sometimes the easiest solutions are the ones that are most obvious sitting right in front of us. And everyone's looking for more control in a situation where you lack complete control when it comes to infertility. So focusing on the things that you can do to be the healthiest version of yourself is always going to make you feel like you're in the driver's seat.
Dr. Lucky, great to see you. Thank you so much. Important info.